We were both sitting in a chair around the lamp. I looked around the lamp and I knew immediately that it was a stroke because her eyes closed, her face was just completely frozen. It all happens pretty fast, and I was glad to hear the sirens coming.
A stroke occurs when the vessels that feed the brain become occluded, usually with clot. And you have a time window of approximately 6 hours to go and get that clot removed, either with TPA infusion to dissolve the clot or mechanically remove it with various devices. And the Solitaire device is just the latest generation of retrieval device. Donna's IR was also 2.7. So her blood was thin because of her atrial fibrillation, and they couldn't give TPA. She was not a candidate because it would be too high of a risk for an intracranial hemorrhage. So mechanical thrombectomy or removing the clot with some other device was the only option she had. And so we were able to utilize the Solitaire device on her, and it was very effective. I think the Solitaire device is a game changer in the treatment of stroke. The Solitaire more efficiently retrieves the clot. It takes less time to remove the clot when we treat stroke. And it's a safer device to use. We have other devices which we use, and they usually take almost twice as long as the Solitaire. The Solitaire average time for treatment is about 40 minutes. And for the entire case for Donna took approximately 1 hour. The Solitaire device actually got FDA approval on March 6th of 2012. And we immediately received training, and she is actually the first patient we were able to utilize this device.
We just think that we were very lucky to get under the wire, that they were ready to have their first patient. And it's something that is going to help everybody in the state.
I feel real lucky.